Hi, my name is Angela. In this video, I'm going to be talking about clinical staffing as a pharmacy resident. Currently, I am a PGY1 resident, about to be a PGY2 resident, but right now when this video is being made, I'm a PGY1 resident in ambulatory care track focused training. And this channel is for me to provide my experience, give some advice, hopefully help anyone out who wants to know what it's like being a pharmacy resident or just has questions about the process. And I always wondered what it was like to do clinical staffing as a resident. Honestly, kind of freaked me out, so I thought it'd be helpful to do this video for any of those of you who are wondering or are freaked out as well. Hopefully it can calm some of your fears, but my schedule specifically, which is not everyone's, but I had a staffing schedule where I staffed every third week on the weekends, and then I also staffed 3 weeks, Monday through Friday, 3 times out of the year. So a week long, 3 times out of the year, and then every third weekend. Every third weekend is pretty nice, I think, in most people's opinion, and it allows you to really kind of breathe versus an every other weekend schedule. Not that an every other weekend schedule can be done and good, but who I staffed with was other co-residents mainly, so other pharmacy residents, and then other regularly employed pharmacists, like kind of staff pharmacists there, who are not in training, but more of it was co-residents. And our model in the institution I'm at was decentralized, so we don't all sit together. We all go to our different units and be a resource to patients and nurses on the floor and communicate through what we have, which is Epic. We communicate through Epic Chat on the EMR, or we use what's called the Sarah, which is like our messaging system, kind of a little walkie-talkie, I like to think of it as. And each of those shifts was always in the evening, and including the ones where I rotated. Some of them have been morning, but the majority were evening staffing shifts. And the responsibility was that you as a resident were covering multiple different clinical services that all filtered down into one queue. So anyone who ordered a different medication from different services would all come into your shift, the queue that you were responsible for. And so that's what you may hear people say, watch my queue, or like, I just need to clear the queue. That's what it means. All these different orders from different shifts, from different services, service lines in the hospital come to you to verify. And really it can be kind of nice to stay in one area to understand the common medications that you see for common indications, common diagnosis, patients, ages, things like that. Or you can be someone who likes to switch around and do different services and see different orders and learn something new. But you just have to know how to find the information you need to know about that drug if you're unfamiliar with it. The safety, efficacy, formulary restrictions, formulary criteria, is it supplied, how is it administered? You kind of have to know the ins and outs as a pharmacist to be able to manage that appropriately. And I would say my program tried to keep it consistent, which I think is nice, just because although I love learning a variety of things, your first time staffing as a pharmacist, you just like to make sure things are done safely and appropriately before you spread out, but that could be different. But other than managing a queue, anything that was dosed pharmacokinetically that was pharmacy's responsibilities, such as antibiotics, aminoglycosides, that was something you were responsible for. Even if an order came through, you need to do all the appropriate steps that your institution asked you to do to make sure that that was taken care of on the pharmacy end of things. A lot of questions, drug-related questions from nurses, physicians, residents. That's a big responsibility, I would say. Random questions throughout your shift, as well as all the other things. This is just different things that I would do on these shifts. Responding to codes, if that's something your institution requires. So stopping what you're doing in the middle of whatever it is and go responding to a code and being in charge of that, or not in charge of that, but being in charge of managing medications if that's your role. And then some admin medrec and discharge medrec. It depends what your institution wants. So reviewing patients' meds when they come in the hospital and reviewing patients' meds when they go out of the hospital. Really, I think this is more of a day shift staff pharmacist role, but that could be something, depending on your hospital, that you will be required to do when you staff these evening shifts. Other random things, you may have to do a more thorough review of some different patients if that's something required, and you may have to do some home med things if that's something your institution requires. So that's just kind of an overview of what you were doing. To me, it kind of seemed very diverse at first, but if you know what boxes to check off as your shift goes along, you can keep track of all those things. I would sometimes make lists just to make sure I checked all the different areas that I was responsible for, because it was not just your queue, it was all the other follow-up things, like I just mentioned. And they were similar to, I guess, a retail shift when I worked retail, about 8.5 hours long. You know, that includes lunch. And then if you don't complete your notes or complete your follow-ups, you have to stay late, or maybe if you do and you have cross coverage, so someone else is there while you are also there ending your shift, you can leave early. It just depends. So things that I learned and I wanted to share about clinical staffing and residency. I grew the most in my ability to make quick decisions and focus on what matters. So I think this is useful in any area of pharmacy practice, but you come through so many different orders and you're not as familiar with the patients as you are when you're rounding. So you know, okay, what do I need to do to make sure that this is safe, effective, and used in the right way for this institution? What do I need to do to feel comfortable with this order, to put my name on it? Not knowing everything about the patient. Do I need to reach out to someone? Do I need to reach out to the nurse? Do I need to look up into this drug more before I click verify? You're going to see a lot of different drugs. So I think that's the second benefit, is that you're just going to get exposure to a lot of different medications, and maybe medications you're used to seeing, but you're not used to seeing how they change in the inpatient setting when they're held for different reasons or held in anticipation of different procedures. It's just a lot of different usage of medications, and it really expands your view. I think that I did a video separately of how I organized inpatient life on roundings, and just like I mentioned, you kind of develop your own system of how to follow up, prioritize tasks. One thing I want to mention is that I would just always forget when a vanc level would come back or a certain drug level that I ordered would come back, because the day kind of gets so busy sometimes you get wrapped up in what you're doing. And you're like, oh yeah, this vancomycin is going to be running. If I don't check the level, I need to adjust it. So I would set timers and just it would give me an alarm and say, you should check that vanc level. So that's just something kind of gets annoying at times, but I think that it always kept me honest and reminding me when things got busy. And then I think sticky notes of like to-dos for the day, pass off from the day pharmacist. So if you like had to follow up on some things from the morning, writing those down so you don't forget. And then the biggest thing I could recommend is just double check things at the end of your shift. You know, a lot of times a shift can be stressful, and that just inhibits your ability to be on top of your game sometimes. But double checking, us as pharmacists know that very well. So I think that just going through all of your steps one more time, even just briefly, looking for red flags, has helped me out a lot in catching different things that were my responsibility. But, you know, just learning how to do this, it was good to remind myself. Other things I would just say is that, you know, try to lighten the mood, play music, joke around with your co-residents, nurses. You know, if you need to walk around the halls because you're staffing in a lone area and you need to go see some other things, if your queue is clear, even if it's not, if you've taken care of all of the acute things, just go take a walk. It could be very, very, very good. The other thing is I had to learn how to contact people and what my priority was as a pharmacist to contact people. So we have a pager system and we have the little vocera, like I mentioned, but you are someone who's part of the team. That order has to be verified by you. If it's a certain type of medication in a certain setting, it has to be verified by you before it can go to the patient. So you have a decision to make. If you need more information or it's appropriate for you to have a conversation with someone before you verify it, then you need to reach out to them. If they don't message you back because they feel like you're not important, that's not true. That's why you're here. You're here to improve patient care. You're here to help treat patients, and you're here to improve the healthcare system. So I had to kind of learn to not be so timid and not be rude, but tell people, I need to know this. You know, can you get back with me? This is important. It's part of my decision making. I would say that it was stressful at times. It was probably one of the more stressful things of residency, especially when you just have a lot of things that you've never seen before and you feel like, oh no, can I even do this job safely? So always reach out for help. You should never feel like you have to learn all that stuff alone, especially in the beginning. But this is part of training. This is part of using your resources. This is part of making complex decisions and critical thinking, just like you would on rounds or in other situations. So always put safety first. Make sure your bases are covered when it comes to safety, and then you can move into like the weeds of like, oh, is this appropriate? Is this the best dose? Is this expensive? Things like that. But and then if you can report safe events to help improve help improve the system from a safety perspective, that would be very much encouraged. So hope this was helpful. I just wanted to kind of speak on my experience. If you like the video, go ahead and like it, share it with someone else who may be wondering what this is like, and let me know if you have any ideas or comments below. But I'll see you guys next week.